Hello guys, welcome to my YouTube channel. Ayanda Nima. I'm a medical laboratory scientist with 6 years of experience in diagnosis in all departments in the medical laboratory. So today I'm with a great topic that affects more than 15% of the world's population, that is accounting for 48.5 million couples worldwide. This is approximately 186 million people worldwide suffering from this medical condition. What are we talking about, guys? We are talking about infertility. In this video, we are going to be talking about what infertility is, the types of infertility, causes of infertility in both males and females, and also ways you can prevent yourself from becoming infertile. And if you're already infertile, or you think that based on the definition of infertility, you are already infertile, we can provide you, or I'm going to provide you in this video, what you can do or steps you can take to regain your fertility. So stay put, guys. All right, guys, let's get straight into our topic of today. We are going to be talking on infertility. And what is infertility? Most people don't really get a clear definition of what infertility is. Infertility is a disease of the male or female reproductive system defined by the inability to achieve a pregnancy after 12 months or more of regular sexual intercourse. Now, there are two types of infertility. There is primary and there is secondary infertility. Primary infertility is defined as when a person has never achieved a pregnancy before, while secondary infertility is when at least one pregnancy has been achieved prior to the infertility condition. Now we're going to be taking you through the causes of infertility in females, and then we'll move to causes of infertility in males. Then we will talk now about prevention and treatment of infertility cases. Stay put. There are 4 different causes of infertility in females. Now it has to do with the structure of the female reproductive organ. We are going to be talking about tubular blockages. Now, the tube that we are talking about is the fallopian tube that links the ovaries to the uterus. And tubular blockages can occur as a result of untreated sexually transmissible infections such as chlamydia, syphilis, gonorrhea. If these infections cause inflammation around this tube, the fallopian tube, then it might leave scar tissue formation after the inflammatory process, can result in a blockage of the fallopian tube. Fibroids. These are benign tumors or abnormal growths that occur in the uterus and can prevent the implantation of a fertilized zygote. We can also have conditions that affect the ovaries, such as the polycystic ovarian syndrome, which is capable of causing infertility in females. There is hormonal imbalance. Hormones in the female reproductive system are produced by certain glands, such as the hypothalamus and the pituitary gland. Though some hormones are also produced by the placenta, some hormones are also produced by the ovaries, but those that regulate sexual function in females are produced by the hypothalamus and the pituitary gland. So if there is any abnormality or disease affecting these glands that produce hormones that regulate the reproductive system in females, then it's definitely going to affect fertility. We are talking about pituitary cancers or hypopituitarism that can result in an underproduction of hormones that regulate the reproductive system of a woman. And all of this can result in infertility in females. So we are going to move now to the causes of infertility in males. There are 4 causes of infertility in males, and most of these causes have to do with the problems in ejection of the semen. Semen is a fluid that is produced from the epididymis that contains sperm cells, which are cells that are capable of fertilizing an ovum or an egg released from the ovaries of a female. Now, certain disorders that have to do with the shape or morphology of the sperm cells also can affect fertility. We are also talking about the motility of sperm cells, the way they are rapid and progressive. If they are less rapid and progressive, there is a possibility of them not to fertilize a mature egg released from the ovaries. So guys, we're moving now to the second cause of infertility in males. We are going to be talking about the functioning or the way the sperm moves, and also the structure or shape of the sperm cell itself. Normally, sperm cells, they have an acrosomal shape with a pointed head and a tail that propels the head towards fertilizing an ovum or an egg. Now, if the shape of the sperm cell is not in order, then there is no way it can result in fertilization of an ovum. Also, there is the way a sperm is supposed to move to be able to make sure that it carries out its function in fertilizing an egg and resulting in pregnancy. If the sperm doesn't follow that way of movement, then it can negatively impact fertility. Also, failure in producing sperm cells can be caused by certain medical procedures such as chemotherapy. Chemotherapy is an invasive procedure that's used to treat cancer cells. So by the use of radiations, if it's not well coordinated, it can result in the destruction of the cells that are responsible in producing the sperm cells that help fertilize an egg. Also, we can have hormonal imbalance that can result in abnormalities related to infertility in males. We have certain glands that help in the production of hormones that regulate the functioning of the male gonads or the cells that produce sperm cells. Glands such as hypothalamus, the pituitary gland, and even the testicles also produce hormones that regulate semen production or sperm cells production in males. We are talking about hormones such as testosterone, which also regulates the production of sperm cells from the male gonads. So all of this can result in infertility issues in males. Now, I want you to take note of the fact that irrespective of whether it's infertility issues in males or females, certain physical factors can result in infertility also. Over-drinking, over-smoking can cause infertility issues, or body mass index higher than normal for both males and female can jeopardize or indirectly result in the abnormal production of semen and can also impact fertilization. So the body mass index has to be normal. If it's higher than that, then work on it, guys. Try to bring it a little down through exercise and all the others. Make sure that you try to visit a medical institution to get diagnosed if you have infertility issues, such that it shouldn't progress and become complicated and will be very difficult to handle medically. So as soon as you notice, as we've defined, that infertility is the failure to achieve a pregnancy after 12 months or more of regular sexual intercourse. If you notice this, that you've been together for more than a year, that's 12 months, and there is still no issue with regards to pregnancy, then do not hesitate. Some people even, start visiting medical institutions if even 6 months or more. though it's defined that infertility is as from 12 months and above of regular sexual contact without getting pregnant. So guys, there are different ways of preventing yourself from becoming infertile. It's basically to make sure that you get yourself diagnosed of most causes of infertility like chlamydia, syphilis, gonorrhea. All the STDs are capable of resulting in scar tissue formation in the male and female reproductive tracts. So it's advisable that you get an early diagnosis of any infection that you might be suffering from, any sexually transmissible infection, such that it can be handled early, because infections such as syphilis that have primary, secondary, latent, and tertiary stages can become so complicated to treat if left to enter secondary and tertiary stages of the disease. So it's always advisable to make sure you screen yourself in a medical laboratory every 6 months to make sure that you're free from all these infections. Also, try to exercise frequently and make sure that your body mass index isn't above the normal. Before you take certain treatment options for certain diseases you might be suffering from, make sure that you are taking them together with your spouse or as a couple, because most treatments for STDs or sexually transmissible infections are given to the couple. If you take it without your partner taking it, then there is a possibility of treating yourself and getting it back from your partner. So when all of this is applied, then you should be able to become fertile. In some cases where infertility is really, really serious, that means there is basically nothing you can do to restore your infertility. There could still be some assisted reproduction techniques or assisted reproduction technologies such as in vitro fertilization can be employed depending on the regulations governing the country in which you live. So these procedures can also be used as the last resort to make sure that you can conceive again. Thanks for watching this video, guys. Subscribe to my YouTube channel Ayanda Nima and click the notification icon such that anytime we upload a video, you will be able to get that. Until next time, and comment in the comment section below what health topics you want me to discuss or you want me to make a video of. Then I'm gonna do just that. I'll do my best to go through all the comments and get the points of interest and work on them and bring a much better video. Stay blessed, guys.